Welcome to Community Health Chronicles, the channel where we explore the stories, struggles, and successes shaping community health in Nigeria. If you care about the future of this profession, stay tuned and don't forget to subscribe. For years, community health practitioners have played a silent but indispensable role in Nigeria's healthcare system. From remote villages to crowded urban communities, they have kept the nation's primary health care alive. But despite their vital contributions, one question keeps coming up again and again. Why do community health practitioners seem to remain at the same level, with little recognition or career advancement? The truth is simple but often misunderstood. Progress in the civil service doesn't happen through agitation or comparison. It happens through documentation, unified advocacy, and institutional engagement. That's the secret many other health professions have quietly mastered, and it's time community health practitioners do the same. If community health practitioners truly want better placement, higher entry points, and clearer promotion structures, then the fight has to move from social media to the policy table. The process must start with facts, documents, and the right channels. The scheme of service that governs community health practitioners, the Unified Local Government Scheme of Service, 2006, is outdated. It doesn't reflect the new academic qualifications now available in community health. It doesn't recognize the Bachelor of Science or Master of Science degree holders who have gone beyond the traditional community health extension worker or community health officer levels. And it doesn't align with today's core curriculum and minimum academic standards, what the Community Health Practitioners Registration Board of Nigeria calls the CCMAS. But here's the good news. The Community Health Practitioners Registration Board of Nigeria is already reviewing this scheme, and that review is the best opportunity in years for community health practitioners to shape their own future. This is where smart advocacy begins. If community health practitioners want real change, then they must engage through the proper professional channels. The Community Health Practitioners Registration Board of Nigeria, the Federal Ministry of Establishments and Training, and the National Council on Establishments. These are the bodies that determine what level you enter, what you earn, and how you progress. Not the state ministries and not social media debates. One major gap holding back progress is low collective visibility. Community health practitioners have the numbers, the skills, and the results, but their voices are often missing in key policy conversations. That needs to change. If community health practitioners begin to organize their advocacy under one structured professional front, through their recognized regulatory board and associations, then their impact will multiply, because policymakers don't just respond to needs, they respond to coordination, documentation, and unified communication. That's exactly how nursing, medical laboratory science, and environmental health advanced their own schemes, by presenting one clear, well-prepared case that government could adopt. What's needed now is a structured, evidence-based proposal, showing the new training levels, the manpower gaps, and how community health practitioners fit into the modern primary healthcare system. That's how Lagos State got community health extension workers recognized at grade level 8 in 2018. Not through protest, but through presentation. That precedent alone can become a strong reference point for federal adoption. At this point, community health practitioners must choose their path. Will they keep venting online, or start shaping policy? Will they act as scattered voices, or as a unified profession with a common vision? Because the truth is, the future belongs to those who organize, document, and engage constructively. If community health practitioners must rise, then the struggle must become smarter, evidence-based, coordinated, and professional. Because in the world of civil service, recognition is not given, it's negotiated. And negotiation begins when you speak the language of policy, not emotion. The rise of community health practitioners is not just possible, it's overdue. But it will only happen when the profession begins to operate, not as isolated individuals, but as one organized, strategic voice for community health in Nigeria. If this message resonates with you, don't just listen, be part of the movement for professional growth. Subscribe to Community Health Chronicles and share this video with a colleague. Together, let's build the recognition community health practitioners truly deserve.